All right, we are live. I'm Dr. Bob Miller, and I'm here with Dr. Brian Anderson. Say hello, Brian.
Hey, good to be here, man. Thanks for
Yeah,
inviting me.
so thanks for being here. I'm going to start with a bold statement, and I'm going to ask Brian some questions here today. But the bold statement is I interviewed an immunologist two and a half, 3 weeks ago. And I told her all the things we're doing in our office. And then I asked her at the end of my statement, I said, is it safe for the general public to go to their dentist or their orthodontist? And she said, her exact words are, the most dangerous part of going to the dentist right now is the drive to and from the office. And, so that's a pretty wow statement. So, hit that wow button if you're live and you're watching us. That, not that you have to agree with that statement. And the purpose of this interview is to answer questions about that statement. Because it is a bold statement. And, there are still concerns of some of our patients we've noticed. But Brian and I have been open now for, over 3 weeks, and we've made some observations we would like to share. So, Brian, I'm just going to start off and just kind of more of an introduction, like why I'm interviewing you, and just give a little history of our relationship. So I've known Brian for about 5 years. He was associated with a practice we acquired, and we worked together for a couple of months and really got to know him, and he's a great friend. But the other interesting thing Brian did at about that same time is he started a Facebook group of orthodontists, a lot of his buddies that he trained with or he knew in his training. They put together this Facebook group, and of course I joined and thought, this is cool, a couple of hundred orthodontists sharing ideas. Well, lo and behold, would he have ever thought that Facebook group grew from a couple of hundred to over 6,000? And it's probably the largest, most influential Facebook group in the study and field of orthodontics in the country. So kudos to you for doing that. But
Thanks.
The thing that was amazing to me, Brian, this is what I want you to comment on, is about 3 or 4 weeks ago, it was just before we opened, you posted in that Facebook group, Orthodontic Pearls, almost a couple of paragraphs on how and why you were going to open. And this was a time when everyone was really concerned, like, should we open now? And if we do open, which guidelines do we follow? And it was a very nervous time. And you were bold, you were decisive, but you weren't a maverick. So comment on that, what you said to help our patients understand, because we basically followed your protocol because it was supported by all the elements we were studying together. So comment on that and tell us what you said and what you did and how it's gone.
Yeah, well, so first of all, much respect to the Millers. They're great orthodontists. I really loved working with both of you guys, and Dr. Bob and I would go out to lunch sometimes, and we would just chat about orthodontics, and that was just so fun. And that's kind of what the group has been, just people that are passionate about orthodontics and trying to provide the best care we can. So, first of all, as healthcare providers, we have the directive to do no harm. And so, we take that very seriously, that, not only are we supposed to improve the lives of our patients, but we're supposed to avoid having any harm come to our patients. And so it's really important that our offices are places that are safe. And that's a really comforting statement, Bob, that you, from the epidemiologist that you talked to or the immunologist that you talked to, that, it's more dangerous to travel than to go to the dentist.
Yeah.
So fortunately, we have, great regulatory bodies, the American Dental Association, the ADA, the American Association of Orthodontists, the AAO, and then local regulatory bodies. In our case, the Utah Dental Association and the Utah Orthodontic Association.
Right.
So the confusing thing has been, from the very beginning, there have been a lot of different guidelines. The CDC has their guidelines, the ADA had their guidelines, and the AAO just said, for now, let's try and follow the guidelines of local agencies, local regulatory bodies. And I really like that directive because this is a regional thing. As we all know, we've been following this for the last couple months. There are certain areas where the risk is higher and there are areas where the risk is lower. And so fortunately, before this all happened, in dentistry, we had what we call universal precautions, which is where we essentially, to protect ourselves and to protect our team members and for the health and benefit of patients, we essentially pretend like everybody has an infectious disease. And so the things that we do are meant to prevent or to reduce the likelihood of any transmission, from surgical masks to the way that we sterilize instruments and things like that. And so just following the recommendations of the Utah Dental Association, Utah Orthodontic Association, we had some clear protocol, and the state of Utah, the Department of Health, we had some clear protocols to follow. And they said, as long as you follow these things, based on the area that we're in, we feel like the risk is minimal and that you can treat patients in a safe way. So some of the things that we're doing are we're minimizing the number of people in the office. And so we're having people, come up rather than coming into the office. When they park in the parking lot, we're having them text and say that, either the patient, if it's an adult, I'm here, or if it's their child, my child's here for the appointment. And then the patient will come up. We're encouraging parents not to come back if they feel like their child can be alone and feel safe and things like that. And of course, minimizing the number of people by not allowing siblings and other people in the offices, because we don't want to have a full waiting room either.
Right.
Because transmission is person to person. At the beginning, the CDC was saying, wash your hands and avoid touching potentially contaminated objects. And there was the thought that, gosh, this virus can live on, surfaces for a couple days or whatever. And so as we've learned more about it, we've learned that transmission is generally person to person. It is through, respiratory droplets, whether coughing, sneezing, or speaking in close proximity, which is why there's the, 6-foot social distancing protocol that we've adopted as a country. So minimizing the number of people in the office. If a parent does come into the office with their child, we want them to be wearing a face mask, because face masks are going, if the parent or person is sick, even if they're asymptomatic and they don't know they have the virus, that prevents, those droplets going into the air. So it would reduce the transmission of the virus. We're reducing the amount of aerosols by taking certain protocols and using high-speed suction to make sure that we're not having aerosols, and we're taking temperatures on all of our patients. And of course, we have a questionnaire that we send out, and we've asked that if you have a fever or body aches or if you feel sick, just for the benefit of everybody, please don't come in, and we can get you rescheduled, and we can take care of things. So for us, we felt like we had good directives, and like I said, we learned more about COVID-19 and the transmissibility and the relative risk. And just by following those protocols, we felt safe. We feel like our team members have felt good. They felt positive, and the patients that have come to the office, there's been a good vibe. It hasn't felt fearful. It hasn't felt I haven't felt like people are apprehensive. So really fortunate that we have such amazing professionals that are doing all the research that they are, so we can understand more about this and we can understand the relative risks, and as much as possible continue to get the treatment that we need, because there is a risk too of having patients in appliances and not being checked. We need to make sure that we're controlling the rate of tooth movement, and that we're putting the teeth where they should be, and making sure they're not going in places that they really shouldn't be in, and that they're not healthy to be in. So we felt really good about seeing patients again, and it's been great to start moving teeth in the right direction again.
So Brian, we took about 6 weeks off. Talk about some of the digital tools that you acquired in that time off to maintain a connection to our patients, and some of the digital treatment protocols you're starting to implement.
Yeah. So those of you that don't know, so Bob actually introduced me to this great virtual platform called Smile Snap that's integrated into our websites now. I know Miller Orthodontics has that on their website, and my practice with my partner, Jeff Chandler, Foothill Orthodontics, we have that on our website. And really, this is something that we were bound to do at some point anyway, just because it's convenient. It's a great way for people to check in and send, photos of their teeth and get a virtual consult. Of course, it doesn't replace the in-person exam. We still need to take x-rays. We still need to actually check their bite to make sure that, how their teeth actually fit is the same way that they bite, because sometimes patients, don't bite the same way, especially when taking photos. So it doesn't replace the in-person exam, but it's been really, really helpful for some of our patients who were concerned and weren't able to come in, and they wanted us to check their progress and see if things were okay. And they were able to go onto the website, and there's this great process where with this software, it tells the patients which photos are helpful and how to take those photos, and they can write in their concerns or whatever their questions are. And then it's great. We have, a queue that we get an alert that someone's written in and posted photos, and we can go to there and we can evaluate the information that they've sent, and we can respond back to them. So that's been really helpful. And honestly, I think, like I said, it was going to happen anyway. And so in some ways, this has been nice to kind of help give us the kick in the rear end to provide that convenience for our patients.
Right. Yeah. And are you doing any other digital workflow treatments? There's the digital treatment process, and then the analog treatment process, and the conventional way of sticking braces on teeth, the way we were taught to do it. This is like, that's just the old way to do it. And so talk to us about some of the things. I know you're doing some in-house aligners, and I'm fascinated by that. I want to hear what you're doing there.
Yeah, so that's been one of the most exciting things to happen in orthodontics in the last few years is digitally programmed treatments. Whether that's something like Invisalign, and we have digital scanners now where we can literally do a digital impression, so we don't have to do the goopy impression. And immediately we can do simulations where we have the actual patient's, teeth digitally on the computer screen in front of us, and we can simulate, what their final outcome could look like. And it's actually their teeth. And so for a patient to be able to see, oh my gosh, I can see the difference, and these are my teeth. And it's really eye-opening. I think that's really, really helpful for a patient to see, rather than just imagining or, hearing things, but to actually see it. Pictures worth 1,000 words, as they say. And so Invisalign is something that we've been doing, of course, for a while now. And other more recent treatments that have been super exciting are InBrace. So InBrace is a lingual orthodontic system. I know, Bob, that you use it. You were an early implementer, and I was one of their early implementers as well. And what's so cool about something like InBrace, the braces are on the tongue side of the teeth, and we do the digital scan. So we get a digital impression. We can see how the patient's bite and their teeth are now. And then we virtually move those teeth into the desired position. And essentially what we're doing is we're putting the braces on the teeth on the computer. So we're saying, okay, here's where the braces need to be, and then putting the teeth into the desired position. And what happens is InBrace will produce what they call a smart wire, which is a robotically bent wire that we're going to use in that case. And they also send a transfer tray. So essentially, it looks almost like a mouth guard, but it has the braces in the tray. So it preserves what the orthodontist has done on the computer screen. And so literally in the appointment, rather than preparing each tooth and setting the bracket on each tooth, and the orthodontist, we move it with our tools, we get it just in the right spot, and then we cure it so it sticks on. We can just take that tray where that bracket positioning has been preserved. It's so cool. And we just slide it onto the teeth and cure all the brackets simultaneously. And it replicates what we did virtually. So that's a really cool thing. And the smart wire that the robot bends, it has a programmed set of movements. So it's always in control, in the sense that you're not going to get movement beyond what you want. It's self-limiting. Right. So yeah, and so for patients that couldn't get in for a couple months, with something like brace, I felt very safe, personally, that their treatment wasn't, their teeth weren't going to move in a position that was beyond, what we wanted. And so,
Those were my most
that was,
interesting cases that disappeared for 3 months.
yeah,
Is that
exactly.
amazing?
Yeah. So that's a really cool thing that we've started doing in the last couple of years. And then another one that I've recently started is called KL Owen braces. And traditionally, braces they have what's called a prescription. And so the braces are made kind of for an average sized tooth, average shape, and there's kind of this average sort of ideal outcome. And so we put the braces on the teeth to try and customize, the position for each patient. But then if that prescription doesn't express and move the teeth exactly where we want them to, that's where we get our, the orthodontist gets the pliers out and gets the wire and, makes the little bends in the wire. And fortunately, we use more flexible wires than orthodontists have used in the past. So, when I had braces as a teenager, the forces were probably heavier and more uncomfortable than they are now. But with something like KL Owen braces, it's the same thing. You do a digital scan, so it's digital, not analog. So analog would be, putting the bracket on each individual tooth. Where digital, we're doing it on the computer screen after we do the scan, and then we're virtually positioning the teeth exactly where we want them, and then a custom bracket is going to be placed on the tooth, and it's got a custom prescription. So basically, that bracket is designed for that tooth to put that tooth in the position that we want for that patient. And so that's another really cool thing that we can do now with, the technology that we have. More precision, more control, hopefully, fewer office visits, and hopefully, reduced treatment times for patients. And so I think what this technology is hopefully going to allow us to do is to be able to execute with the same precision or even improved precision and do it in a more timely manner that's more convenient for patients. So those are some of the things that we're doing. I know there's some other really cool things out there. So there's another company called Light Force.
We just started Light Force, which is very similar. It's a custom milled bracket that's, again, the digital, to me, having that digital level of precision makes a huge difference for the patient. Fewer office visits, greater intervals in between the visits. You don't have to come in the office as much, but most importantly, shorter treatment times. I think it's amazing what we have at our fingertips now.
And the thing I love about something like Smile Snap, the virtual check-in software, is if a patient's concerned about having a longer interval. I think most patients like the longer intervals, knowing that they're not they're not increasing their treatment time. Because I think the normal thing for a patient would be like, oh my gosh, if I'm going 12 weeks between appointments rather than 6, does that mean I'm going to have my braces on for longer or my aligners, for longer? And the answer is no. That's not. It's intended to be fewer visits in the same amount of time, or even reduced time. And if patients have a concern, in that 12 weeks, they can hop onto the website. They can fill out, the Smile Snap questionnaire, submit photos, and we can respond to them in a timely manner. And so that way they don't have to come into the office. I know how hard that is. I've got 4 kids. My oldest is 11, and my youngest is 2. And on a day off, if I have to take, the kids to the doctor and I don't have help, then it can be a really challenging thing. And so we have a lot of moms, and of course we've got some dads that come into the office and they have to bring the whole family. And so if we can make things more convenient for our patients, I think that's a huge win.
Yeah, I just think, to me, there's just a lot of things going on right now, a lot of uncertainty, a lot of unknowns, both, in healthcare in general, but also our profession, and a lot of professions, the same things, the do-it-yourself technology, it's out there. And, whether we like it or not, it's a reality. It's going to appeal to a certain type of patient. But, let's just kind of wrap up and just comment on how you feel the do-it-yourself technologies will either benefit or maybe get hurt by, the recent changes in our world.
Yeah. Well, so going back to, you had asked me about in-house aligners, and I didn't answer that. I realized,
Right.
but this is a great place to talk about that, because the DIY, or direct to consumer, we call DTC,
Yeah.
orthodontic systems out there, usually are what you go into what's called like a smile shop, and you have your teeth scanned, or they mail you impression material where you load it up and you do the goopy impression yourself and you mail it back. And then customized aligners are shipped to you. And I think it really appeals to people who are looking for something that's convenient. It definitely is convenient. There's no question about that. You have stuff mailed to you. You don't have to have office visits, etc. But the concern is, and what I've seen, I belong to some groups where there are people that have done this and they're unhappy, and the things that I've heard is that they feel like they don't have access to a doctor. Even though there is a doctor that approved the case, there's no recourse. They can't call that doctor on the phone or send something in virtually and have a conversation like they can with us on SmileSnap. And in certain cases, we can have customized aligners, and we can have very, very similar convenience for patients at a similar price, but there's oversight. If there's a problem, they come to me, and I'm going to be there for them. I'm going to be able to answer their questions. And then we can do office visits as needed, because there are certain things with clear aligners that to get the best outcome, you have to do certain types of adjustments to the teeth in person, whether that's polishing between the teeth or contouring or adding little tooth colored handles, or what we call attachments on the teeth, so that the plastic can grip the teeth and push, with the right force, the right vector to move the teeth. So there are certain things that you really can only do if you're having the attention in an office to get those types of movements. So I think what's important for patients to know is that when you see an orthodontist, we are going to do all the records necessary to give you a proper diagnosis. So it's very important to get x-rays to make sure that the roots are healthy, that the bone surrounding the teeth is healthy, to look at the position of the jaws to see how the jaws are aligned and how that affects the bite. I usually tell patients that I know that patients don't often come in to adjust their bite. Their chief concern is the alignment of their teeth, the aesthetics.
Right.
And it makes sense. I had braces as a teenager, and I remember hearing the word overbite. I'd ask my friends, "Hey, you got braces too? Why'd you get braces?" "Oh, I have crowding. I've got an overbite." I think everyone knows what that term is, but the reason it's important to address the bite and not to neglect it is that when the bite doesn't fit together, when the teeth aren't aligned properly, upper to lower, there can be increased wear with time. There can be traumatic forces of the teeth, where you're more likely to damage the teeth or break the teeth or wear them down over time. And so it's very important to not neglect the bite. So yeah, when you see an orthodontist, we're gonna get a proper diagnosis. We're gonna get the proper X-rays. We're gonna get the proper photos, so that we can really prescribe the right type of treatment. And for the patients that where if you're a good candidate for that limited treatment with aligners, where you really don't have to do many visits at all, our prices are very similar to the DIY DTC companies. But again, with us, there's recourse. And so I would actually say going with an orthodontist is more convenient, because you can get a hold of someone if you have a problem with your treatment. I mean, talk about an inconvenience. If something's going wrong and you can't get it addressed and you don't know who to talk to and you get the runaround, that's not convenient. So I think we have our best patients in mind, or the best interests of our patients in mind. Again, do no harm is something that we take very seriously. So it is exciting to be able to offer things that are more customized to patients now, and take advantage of that technology. But again, the most important thing is proper diagnosis and prescribing the right treatment for the right patient. My dad was a physician. He retired a few years ago. And I remember thinking as a teenager that I wanted to be a physician. And of course, I'd hear my dad on phone calls, and he would call pharmacies and prescribe medications. And, as orthodontists, as you know, Bob, we don't often prescribe medications. We can. We have the training and background and the license to be able to do that. But really, I view our job as mostly prescribing the appropriate treatment.
Right.
And that's really important because in the end, people come to us for a result. They don't come to us because they want to wear
Yeah.
braces or
Right.
they want to wear aligners. They come because they want a result.
Yeah.
And so if we're giving a treatment that doesn't achieve that result, then it's not the right treatment. It's really it can be very frustrating.
The
So
interesting thing you just mentioned is our training is diagnosis and treatment planning. Actually doing the work is quite methodical, and quite, just routine. But the diagnosis and the treatment planning is the key. And why is that so important now? Why are there billion-dollar companies in that direct to consumer? And it's really because of exactly what we're doing right here. We're
mhm,
doing a live video, your smile and my smile. We're in the camera. This is the social media era, and everyone wants to have a nice smile. And our whole purpose, and to best summarize what you've said, is we just want to give that patient a smile that will last,
yeah,
that it will be there in 5 years, 10 years,
hmm,
the rest of their life. And if you go, in general, I'm sure the direct to consumer products do perform, with for some patients, but in general, it's the long-term stability. There's just no way if you're not addressing the bite and, where does stability come from? And it's a really hard thing to explain to a patient. And the
yeah,
way
yeah,
I best explain it is I just want your teeth to look as good the day we take them off 5 years from now. And that's our goal.
absolutely, absolutely. Our jobs are interesting in the sense that we don't have lifetime patients that we see every few months. That our job is really to, in some ways, to put ourselves out of business by treating them right and
Yeah.
giving them good stability, and then they don't have to come back. And
Right.
if you don't mind, I just want to share two sort of quick stories that I think are kind of fun that relate to this. Um, so I learned a really important lesson in college, and this story that I call the parable of the ping pong paddle, the quadruple P. So like some good alliteration there. But
Yeah.
as a college student, of course, I didn't have much income. I had a part-time job to just kind of make ends meet, and I was going to school full time. And so money was a big deal. I was mostly eating cup noodles for lunch, and whatever was
Sure.
relatively quick and inexpensive. And I always loved to play ping pong. Growing up, I played tennis. I played tennis in high school, and that was really fun. And growing up, we had a ping pong table, and there have some similarities. And so I love
Mhm.
ping pong. So I remember going to play with my friend Nate Soph one time in college, and we were going to go get new paddles. And of course, there are varying star levels based on the quality of the paddle. And I think the 5-star paddle is the most expensive one, and then 4 stars a little less. And that one's not quite as nice. It doesn't have as much spin that you can put on. It's not as tacky. And of course, 3-star and 2-star and 1-star. And I remember, because I didn't have very much money, I went with, I think, the 4-star paddle. And like I said, I was a pretty good ping pong player, and so like the way that the paddle responded was important to me. I remember taking it back, and Nate and I played, and I think that paddle cost $20, the 4-star,
Mhm.
and the 5-star paddle, the best one, cost like $30 or something like that.
Mhm.
I remember playing with the 4-star paddle, the $20 paddle, and almost immediately realizing I've made a mistake. I've made a mistake.
Right.
It's not performing like I want it to. And then this is what really hit home, and I've never forgotten it, and it's really influenced the way I make decisions, especially purchasing decisions since then, is that I thought, okay, I've invested $20 in this paddle that I'm not happy with. And now I want to go get the 5-star paddle. So now I'm going to have to invest $30 to get the paddle I want. So now I'm
Right.
in $50 for a
Yeah.
$30 paddle. If I
Right.
just would have gotten the $30 paddle from the very beginning, it would
Yeah.
have been so much better. And I've seen that with patients who have done the DIY or DTC treatment where they spend a couple $1,000s
Mhm.
and they don't get the results. Again, it's all about results. They don't
Yeah.
get the results they want. And so then they come into our offices And I mean, we try to be compassionate and considerate to, if we can, offer a discount just because we feel their pain.
Yeah.
But then ultimately they end up spending more money than they would have had they just gotten the right treatment from the very beginning.
Yeah.
So that's an important lesson I learned, and I've seen play out in my orthodontic career.
Yeah.
And the second thing is, again, prescribing the right treatment, because there are certain treatments that are not appropriate for certain type of tooth movements. And it's just the biomechanical reality of things to move teeth a certain ways. Some treatments can do that, and some other types of treatments can't. And it reminds me of being a kid. One of my best friends, Dan Erdley, he had chores that he did every week. One of his chores was to mow the lawn, and I think he got paid $1, and it was like 1 acre. It was a big yard, man.
A day's
and
job.
He was one of the best. Exactly, and this was in the 90s or something. I don't know. I was in elementary school. I remember being in his backyard one time. I had this baseball bat, and I was swinging the baseball bat almost like a golf club, like on the grass. I was swinging it down on the grass, and I noticed that when I'd swing it, I'd cut the blades of grass every time I was swinging it. And this was like one of those things that, like, I've never forgotten. It was so important of a lesson. I remember asking my friend Dan, I said, "Hey Dan, dude, how much would you pay me if I mowed your whole lawn, acre, with a baseball bat?" And he said, "Well, I'd pay you $1." I said, "Are you serious, man? Like, it would take like so long to do it with a baseball bat. Like, why wouldn't you pay me more?" And he said, "Well, because I can use a lawnmower and do it for $1, and it's way better and it's less expensive. Why would I pay you more to do a baseball bat?" And so for me, the lesson was, you have to use the right tool for the job. And there are some tools. Could I cut the whole lawn with a baseball bat? I could. Mm-hmm. Would it be a smart thing to do? And would it look anywhere close to as nice as if we use the right tool? Absolutely not. And my friend Dan understood that.
Yeah.
And so when patients come in, they want a certain type of treatment. It's not all the same. Just like mowing the lawn with a baseball bat is very different from mowing the lawn with a lawnmower. So again, it really is all about diagnosis and treatment planning. It is about using the right tools. And there are certain tools that are not going to get certain results. And again, if you have fixed in your mind, I'm coming for a result. I'm not coming for a product. I'm not coming for a certain type of aligner system. I'm not coming for a certain type of whatever. And if those things can't give me those results, then it's not a good investment. And that's our job, is to help educate the patients and let them know, okay, let me understand you. Your concern is XYZ. Am I getting that right? Mm-hmm. Okay, to solve that concern, here's what we're going to have to do to get the teeth in the right position.
Right.
And that's so important, because there really isn't one size fits all. And I certainly couldn't treat every patient with aligners, Invisalign. I couldn't treat every patient with InBrace. I couldn't treat every patient with, customized, in-house aligners that we make. We call Premier aligners. Yeah. So it's using the right tool for the right job.
Yeah. Brian, this is great. I really appreciate your time. We took a little more time, but we really covered a lot of ground. And thank you for doing that. We'll just close on this thought. At the end of the day, we want our patients to feel safe and comfortable in our office, but we really want to minimize their time in our office and the number of visits they have to make. And now more than ever, it's significant. And so we really just, we both feel very comfortable in our practices. Our employees feel comfortable working for us. And I think our patients, as time comes by and they make a few visits, they're going to realize it's very safe to go to a dental office right now. So thank you for your time. I really appreciate it. And this will be posted. So if you want to ask any questions, you can still ask questions in the comment section. If it's a question for Brian, I'll make sure he gets the question and we'll respond. So thanks again, everybody. And thanks, Brian, for your time.
Always fun talking with you, man. I love shooting the breeze with you about orthodontics.
Yes. All right. We'll do it again. Talk to you later.
All right, man.
Okay.
Take care, Bob. Bye.